Jessica. I'm going to be your nurse. Just going to wash my hands. Provide privacy. Can you tell me your name and your date of birth?
My name is Jose Ortiz. I was born on March 20th, 1998.
Okay. Any allergies to any medications that you're aware of?
No.
Okay. Are you comfortable? Yep. Okay. Well, my name's Jessica. Like I said, I'm going to be your nurse. What I'm going to do is do a physical assessment, head to toe, just to make sure everything's fine with you, okay? Do you have any questions for me?
Fine.
And you said you had no allergies to any medications, right? Okay. So the first system that I'm going to be looking at is going to be your hair, your skin, making sure everything looks good. So what I'm going to do is I'm going to be assessing your scalp. Looks good. Looks like it's intact. Your hair looks good. Okay. Skin looks in general, no rashes, normal for ethnicity, warm, dry, intact. I see no wounds, no drainage. Going to skin turnover is elastic. Capillary refill is less than 3 seconds, which is normal. Okay. The next system that I'm going to be looking at is going to be your ears, your nose, your eyes, and your mucous membrane, which is your mouth, okay?
Okay.
So first thing is I'm going to just be looking at your ears, making sure there's no drainage. Have you had any problems with your ears or hearing lately?
No.
No? Okay. So if you can take off your glasses for me. What I'm going to do is just shine the light in your eyes, just making sure your pupils are reactive, everything's going okay. So if you can just look straight ahead for me. Good. Bright light. Good. Pupils are round, reactive, 3, equal, brisk. Going to take a look at your nose, okay? No septal deviation noted. Pupil nose is pink. Can you open up your mouth for me? Good. Mucous membranes look good. Pink. Moist. No signs of thrush. Okay. You can put your glasses on if you'd like. Can you smile for me? Good. Smile is symmetrical. Everything looks good. So and at the same time now I'm going to be palpating is your carotid. Good. No heaves, thrills. Now I'm going to listen to it with my bell, with my stethoscope, one at a time. Good. Good. Now the next system that I'm going to be taking a look at is going to be your respiratory, okay?
Okay.
Are you having any pain breathing?
No.
Any pain while coughing?
Mm-hmm.
No. Any chest pain at all?
No.
No. Respirations look unlabored, no use of accessory muscles, 12 to 20 respirations per minute. Looks unlabored. So if I can ask you to sit on the side of the bed, what I'm going to do is I'm going to be taking a listen to your lungs. And if you could just take slow, deep breaths and exhale. Good. 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 And I would do the same anteriorly as I did posteriorly. His lungs sound clear. No crackles, no wheezes within the bases throughout. If you want, you can just go ahead and lay back. And because you're in the hospital and to prevent any pneumonia, because of you being in bed all day, I would teach you how to use an incentive spirometer, okay? That's just going to help expand your lungs and prevent any pneumonia and complications occurring in your lungs, okay? Alright, so the next system that I'm going to be taking a look at is your cardiovascular. Going to be taking a look, listen to your heart, okay, making sure there's no murmurs, no gallops, any of that, no extra beats. Okay, so the first thing is I'm going to look at your chest. Looks good. I don't see any thrills, no pulsations occurring. So I am going to palpate your point of maximum impulse, and that's going to be on your left sternal border on your 5th intercostal space in your midclavicular line. Good, no thrills, no pulses. So now I'm going to be listening to your heart, okay? The first as I'm going to be listening to is your aorta, and that's going to be in your right sternal border in your 2nd intercostal space. Next is you're going to be your pulmonic, and that's in your left sternal border on your 2nd intercostal space. Next one's going to be Erb's point, which is in your left sternal border on your 3rd intercostal space. The next step is going to be your tricuspid, and that's on your left sternal border on your 4th intercostal space. Next one's going to be mitral, and that's on your left sternal border on your 5th intercostal space. I do not hear any murmurs or gallops or extra beats. I hear S1, S2, also known as a lub dub. Heart rate sounds normal sinus rhythm. Heartbeat is 80. Have you been having any chest pain?
Nope.
No? None? Okay. So now the next step is I'm going to be going to take a look at your belly, your bowel movements, make sure everything's going okay. So if you could just lie flat on the bed for me, please. Okay. So what I'm going to do is while I'm doing this, I'm going to be providing privacy. So I'm just going to inspect the abdomen, make sure it looks good. But before I touch it, I'm going to be listening to your bowels. I'm going to auscultate. All 4 quadrants. If I did not hear any bowel sounds, I will listen to each quadrant for up to 5 minutes. Bowel sounds are present, hyperactive. Have you had any nausea, vomiting, or diarrhea? No. No? None? Okay. So, abdomen, belly looks symmetrical. Now I'm going to be palpating for any tenderness, guarding, or lesions. Lightly first. Any pain? None? Okay. So now I'm going to press a little bit harder, okay? Any pain as I'm doing that?
No.
Nope. Belly is soft, non-tender, symmetric, flat. Okay. I'll also, while he's in the hospital, I'll be monitoring his intake and his output, making sure everything's going okay. So the next step is, when's the last time you had a bowel movement?
An hour ago.
An hour ago. When's the last time you urinated?
An hour ago.
An hour ago. Do you usually urinate out quite often, or is it normal? Have you been urinating normal, or have you been finding that you've been having problem urinating, such as any pain while urination, or dribbling?
Nope.
No, none?
No.
Okay. So now what I'm going to be doing is I'm going to be taking a look at your musculoskeletal system, okay? So what I'm going to need you to do is just squeeze my hands tight. Good. I'm going to be listening to your radial pulses, and that is a +2. Capillary refill is good. Any numbness or tingling that you've been having?
No.
None at all? Okay. So I'm going to also listen to his pulses and his speed. +2. Capillary refill is less than 3. Can you push my hands like you're pumping brakes? Good. Everything's within functional limits. Looks normal. Everything's intact. Like I said, skin temperature is warm, dry, and elastic. Do you have any, and this concludes my health assessment. Do you have any other questions for me? No? Is there anything else I can do for you?
No, I'm quite fine.
Okay. I'm going to wash my hands. Side rails are up. Call light is within reach. My patient has non-slip socks on. And you have a good day, okay?
You too.